There is some big news from the FDA that is making waves in the world of weight loss medications. The FDA has instructed pharmacies to stop compounding the popular weight loss drugs like Ozempic and Zepbound, which turned to be less expensive. This decision was made after officials determined that there is no longer a shortage of these GLP-1 drugs. For many people who have been relying on these more affordable compounded options, this could mean having to stop using them because the brand name alternatives can just be quite costly. The ban on these medications, these alternative versions, which contain ingredients like tirzepatide and semaglutide, is already in effect for some and will soon apply to others. This is part of the FDA's updated rules for pharmacies making cheaper versions of drugs from companies like Eli Lilly and Novo Nordisk. The FDA's decision followed a court ruling against pharmacies producing these alternatives. This move is going to impact both patients and providers. Weight loss clinics and telehealth services such as Eden, Mochi, Ro, Him and Haas have been offering these alternatives due to past shortages. Now they must halt production, leaving patients worried about losing access to an essential tool for weight management. There is also a concern about whether Eli Lilly and Novo Nordisk can produce enough of their drugs to meet the demand, and if prices will rise without competition from these alternatives. For weight loss clinic owners, this presents a challenge. They might now need to explore new strategies to support their clients, such as focusing on personalized diet, exercise plans, or exploring other FDA-approved medications. Building strong relationships with pharmaceutical companies might also help in securing better pricing or availability for their clients. Some patients who have been using these compounded drugs to manage their weight, they are worried about the future. They fear they might not be able to afford the brand name drugs or might have to look for alternatives, which could be risky. So let's talk about it. What are compounded drugs? Compounded drugs are custom-made medications usually preferred by pharmacies when commercially available drugs don't meet specific patients' needs. However, they aren't FDA approved, meaning their safety and effectiveness aren't verified by the agency. These medications, they usually work by targeting the brain or certain hormones to suppress appetite and are usually part of a broader plan that includes exercise and diet. Some experts say that compounded drugs represent a new approach to treating obesity as a chronic condition. So removing them could deny people an important tool in their health journey. So let me know, what do you think about this FDA decision? Is it fair, or does it set back those striving to manage their weight? Please let me know your thoughts in the comments, and don't forget to like and follow. Thank you.